It's something we talk a lot about here on 11 Alive through our Better Work initiative. That construction is one of the fastest growing industries in our state and one of the most important. There's also a lot of opportunity in terms of workforce development. When we're talking about construction, we're talking about $80 billion in state money while supporting about 250,000 workers in Georgia. And now there's a new push to bring mental health resources to Georgia construction sites. Joining us is Bill Anderson, the president and CEO of Associated Builders and Contractors of Georgia, to talk more about it. Good to see you and appreciate the time.
Yes, Cheryl, good afternoon. Thank you for this opportunity.
Yeah, glad to have a chance to talk about this. You know, safety has been a conversation on construction sites for so long, but really more in terms of maybe PPE, hard hats, that kind of safety initiative. This is a safety initiative about mental health. Talk to me about the need for this and why the shift now.
Well, Cheryl, we've been addressing mental health for many years in the construction industry, but we really wanted to focus on this, especially since May is Mental Health Awareness. And one of the things everybody thinks about in construction is safety on the job site, safety goggles, hard hats, gloves. But we are really focusing on the whole body mental health, and that includes mental health issues that we can help within our industry and the workers. Construction can be challenging at times on job sites. There's large equipment, there's tools, and there's, dangers, obviously, for safety reasons. But if a worker comes to the job site as having mental health issues, it's not very apparent. It's kind of like a silent epidemic with depression and anxiety. And if they're not focused on their job, it's not like going into an office, job, make a typo or send the wrong email. On a job site, it can be really affecting other workers. It can be safety issues. There can be injuries. So we really want to see that all our workers are coming to the job sites and don't have any mental health issues. The construction industry has been typically, it's a tough guy stereotype. There's more women coming into the industry, but it is a male-dominated industry, and so there's a lot of long hours on job sites. Some of the job sites, Cheryl, may be far away. Workers have to drive a long way, or they may be away from their families the entire week because the job site may be hours or even in another state. And that can bring mental issues and other areas that need to be addressed with our workers, not just the physical well-being, but to ensure that they are mentally well-being too.
You make so many important points. It is really important to emphasize that someone's emotional and mental well-being can really impact the work that they're doing. And when you're working with heavy machinery or a site that can be dangerous, maybe it's elevated, or the different tools you're working with and the team you're working with, that physical safety goes hand in hand with this mental health support. And as you talked about, it may not be something that workers feel maybe open to talking about. So what training are you providing for supervisors, for example, who might then be able to identify something that's unspoken, but be able to then give support? How does that play out on a job site?
Well, Cheryl, one of the things that we're really focused on is ensuring that the mental health, making sure that the supervisors and even the workers understand the challenges they face. And we have a mental health champion at our local chapter here, and they're certified to lead suicide prevention training. They can provide training on the job site or in their offices. We've offered three. We're going to offer three mental health training classes this year. One of them is really kind of excuse my French, but the title is Pause When Pissed. It's a mental health fitness course, and it lets everyone understand it's okay that if they're not feeling the best and with their mental health issues, that it's okay to speak up and tell their supervisor and address it at that point in time. We've partnered with the Georgia Department of Behavioral Health and Developmental Disabilities. That's that's a lot to say, but they talk about they have strong enough to care Tough Enough to Talk classes. They're stressing the 988 suicide prevention line. A lot of people maybe have heard of that, but we really want to ensure that our supervisors and the workers know that that line is there, and that can be critical to helping them through with their mental health issues. And we've partnered with a mental health company to offer classes, and we've even trained our board of directors on this. We have someone here that's a mental health champion in our office, and he can go out and talk to companies and work with their supervisors as well. So there's just a lot of total health, human body efforts that we've been making over the years, and we want to make sure that it doesn't just because you can't see it. We know if a worker's not being safe because they may not have their safety goggles on, their hard hats, but it's very hard, if not impossible, to see mental health if someone is having a challenging day. So we want everyone to be comfortable in speaking up about it and letting their supervisors know. I know one good thing is social media and public figures have helped with this effort because they are speaking about it as well. So we want to speak about it in the construction industry because it is just as important as the physical well-being of our workers.
We talked about 250,000 workers in construction across Georgia. Have you done any surveys or research to find out how big of an issue mental health challenges are to that workforce in particular?
Sure, we don't have any numbers on that. We do know that there have been suicides in the construction industry, and it may be higher than a lot of other industries, and that's kind of probably relates back to the challenges that I mentioned earlier about just the long hours, the tight deadlines, even in the summertime, there's extreme conditions with heat, in the wintertime cold. Those are a lot of the issues that can be maybe driving this. And like I said, it seems to be that mental health issues and suicide even probably I think is higher with men than it is women. So being a male dominated industry, that is probably maybe why we have some higher numbers than some other industries.
All right. Well, we know that construction continues to be an in-demand job in the state of Georgia, and the conversation around supporting every aspect of those workers is an important one. We really appreciate the time. Bill Anderson being here on the stream with us, President and CEO of the Associated Builders and Contractors of Georgia. Thanks so much.
Thank you, Cheryl.